So next is vascular surgery, iliofemoral vein thrombosis. Number 1, 55-year-old woman presented with a 2-day history of painful swollen cyanosed left thigh and leg. Past history was only significant for long haul flight of 12 hours 2 weeks previously. There was no other history of note. D-dimer was grossly elevated, and a venous duplex scan showed deep vein thrombosis of left common iliac vein extending to the left superficial femoral vein. Please detail your initial management of this patient. So bed rest, leg elevation, blood test including FBC, coagulation profile, fibrinogen, UNEs, LFTs, chest X-ray, ECG, arterial blood gases, CT pulmonary angiogram if indicated in patient with a suspicion of pulmonary embolism. Consider an underlying cause at a later date. Thrombophilia screen, rule out malignancy. What options are there to treat this DVT? So the primary objective of treating DVT is to prevent the extension of thrombus, to prevent the PE, and to reduce the morbidity and mortality by reducing the incidence of post-thrombotic syndrome. So number 1 is unfractioned heparin, which needs close monitoring in the form of APTT, and its mechanism of action is through the antithrombin 3. Then is the low molecular weight heparin, which which is better than the heparin in the form that it has predicted dose response relationship. It reduced binding to the platelets, which there is a low incidence of heparin induced thrombocytopenia, and it don't bind to the other plasma proteins, and it reduced ability to catalyze the inactivation of thrombin. And given its renal clearance, low molecular heparin may not be feasible in patients with renal disease. Number 3 is vitamin K antagonist warfarin, which anticoagulate by blocking the enzyme vitamin K epoxydirectase. 2, 7, 9, 10 factors are not working accordingly. And then now are the new oral anticoagulants, which are in the form of direct thrombin inhibitor, does dabigatran, or the direct factor 10 inhibitor, that is rivaroxaban, apixaban, and edoxaban. And then is a catheter-directed therapy, which is called thrombolysis. Absolute contraindications are established cerebrovascular accidents, or TIA, the last 2 months, intracranial trauma last 3 months, neurosurgery last 3 months, recent bleed 10 days, active bleeding diathesis, or significant thrombocytopenia. What is the role of IVC filter? There is no role of clear IVC filters improve outcomes. Rather, there is a complication of IVC filter, which includes the fracture, migration, damage to the veins once in for more than 6 weeks. It is difficult to remove endovascularly. What is the role of venous stents in the patient with iliofemoral DVTs? Venous stenting appears to be an effective adjunct to early thrombus removal, particularly associated with the May-Thurner syndrome. Although the stents placed for external compression have less favorable outcomes. May-Thurner syndrome is a condition in which the left common iliac vein system is compressed by the right common iliac artery, and patient have deep vein thrombosis. What is the role of intravascular ultrasound scan? Intravascular ultrasound scan is essential as it affects management and decision to stent. And there are a few trials which did not very hopeful. Thank you.